Hello, today we're going to be talking about care of the patient with problems of HIV disease. Here are the learning objectives, including collaborating with the interprofessional area team, preventing HIV transmission to yourself and others, identifying community resources for our patients with impaired immunity, assessing all adults of high-risk behaviors related to HIV, implementing evidence-based nursing interventions to assist the patient and family coping with HIV, signs and symptoms including lab data about HIV and impaired immunity, teach the patient caregivers about common drugs used for the impaired immunity and HIV prevention. Now, just a very quick pathophysiology review. This is on pages 337 to 338. To infect, HIV must first enter the host's bloodstream and then hijack certain cells, especially the C4 and T cells. The CD4 plus T cells directs immunity and regulates the activity of all of the immune system cells. When HIV enters a CD4 T cell, more virus particles are created. The virus-host interactions are needed after infection for the disease to develop. Virus binding to the CD4 receptor and to either the co-receptors is needed for HIV to enter the cell. HIV particles are made within the infected CD4 plus T cells using the metabolic manufacturing of the host cell. And here we have a picture of that. If you look, you can see here you have the CD4 plus T cell. And here you have the CD4 receptors and the co-receptors. When you have the HIV virus, it takes both the co-receptor plus the CD4 receptor to be infected with the HIV virus. Effects of HIV. Everyone with AIDS has HIV. Not everyone with HIV has eggs. The number of CD4 plus T cells the patient has is whether any opportunistic infections have occurred indicates the difference. Immune cells can attack and destroy early on. The number of HIV particles overwhelms the system over time. The thing is that medication can slow this process. According to the CDC, about 80% of people in HIV care are virtually suppressed at their last test. Now, what that means is that about 80% of persons with HIV have been able to suppress the HIV disease at their last testing. And we'll learn in just a few slides that about 65% are currently have their HIV disease at where it is undetectable. But currently, according to the CDC, about 80% of people in HIV care have virally suppressed at their last test, meaning that their amount of HIV virus was less at their last test than it was at their test before that. But about 65% currently, with being on suppression therapy, have their HIV disease virtually undetectable. Now, this is one of the sheets that I sent you the links to, and the link is also listed here on this slide. According to the CDC fact sheet, Understanding the HIV Care Continuum, people living with HIV who are on an antiretroviral therapy, or the ART therapy, as prescribed, and get and keep an undetectable viral load, meaning they're taking their medication as prescribed, they're not missing doses, they're taking it when it's ordered, have effectively no risk of transmitting HIV to their HIV negative sexual partners. Again, this is on that Understanding the HIV Care Continuum sheet, and this is the link to get to that. What is the HIV continuum? The continuum is the series of steps from the time a person receives the diagnosis of HIV through the successful treatment of their infection with HIV medications. And again, here's a link to that same fact sheet. Oops. So, what are the 2020 objectives on the HIV diagnosis and care? Increase the number of HIV positive individuals aware of their status to 90%. Increasing the proportion of newly diagnosed HIV linked with care within 1 month. So when they're diagnosed with HIV, that they are receiving appropriate care within 1 month. Increasing the proportion of HIV diagnosed individuals whose virus is effectively suppressed to 80%. And again, here is that fact sheet to get there all about the HIV care continuum. And as I was saying, in 2018, the HIV diagnosed individual whose virus is effectively suppressed was at 65%. Again, the goal for the 2020 was to have the HIV, those individuals diagnosed with HIV, to be effectively suppressed at 80%. In 2018, we were currently at 65%. And that was the most current data that I could find on the CDC websites. They have not been, the HIV, even though it has been reviewed, the HIV statistics have not been updated since 2018. My understanding is they are updated about every 2 to 3 years. The HIV fact sheet. This information is from the HIV Basics Overview, and that is listed here for you to get there. The HIV Fast Facts. 1.2 million people are currently living with HIV in the United States. This number was stable from 2014 to 2018. In 2018, 14%, that's 1 in 7, did not know they were infected. This number has decreased from 20% in 2015. In 2018, the highest rate of new diagnoses of HIV were in the southern region of the United States. In 2018, the largest percentage of HIV infections were attributed to male-to-male sexual contact. That's 67% overall and 82% among males. And again, if you want to see those fast facts on your own, the link is here for you. Recommendations for HIV screening. The current recommendations are one-time screening for all people ages 15 to 65, an annual screening for people in high-risk groups. It is now part of routine prenatal screenings. More frequent testing for adults with repeated high-risk exposures. And a list of those high-risk exposures are on page 341, chart 19-1. This chart includes people who have sexually transmitted infections, IV drug users, women of childbearing years with undeniable risks, such as IV drug injections. They also will recommend HIV testing if you have been in a relationship with someone who has not been monogamous. So you should also have annual testing done or more frequent testing done if you're planning to get married. They are also encourage more frequent testing for patients who have, who are considered sex workers. And it is a routine part of prenatal screening when you are pregnant. And you should have one-time testing. The book says between 18 and 65. The CDC says between 15 and 65. Again, the rest of that chart is on page 341 for you to look at. Healthcare promotion and maintenance. HIV is transmitted 3 ways: sexual, whether it's oral, anal, or genital; peripheral, through sharing of needles and healthcare workers if they are stuck with a dirty needle; and perinatal, from the mom to the baby. Pre-exposure prophylaxis is called PrEP. PrEP is the use of HIV-specific antiretroviral drugs in a person who is not infected with HIV. The purpose of PrEP is preventing HIV infection. The approved drug combination for PrEP is Tenofovir 300 milligrams and epinephrine 300 milligrams, and that's given once a day. As you can see, it is a combination medication, but that is the one that has been approved to use as PrEP. This is for people who are in a high-risk group, mainly for homosexual males who are, so that they can prevent getting HIV from sexual partners, because PrEP is used with using the specific antiretroviral drugs in a person who is not infected with HIV to prevent HIV infection. Post-exposure prophylaxis. Now, these are the reasons for post-exposure prophylaxis. It includes occupational exposure, needle sticks, sharps injuries, exposure of non-intact skin, mucous membranes to blood or blood fluids. Think about splatter. Standard precautions is the best prevention. On page 345, chart 19-2 is the best practice for patient safety. And it talks about recommendations for preventing HIV transmission by healthcare workers. And it talks again about standard precautions being the best way to prevent that. Also, to make sure that you have any wounds that you have covered, or any weeping contact dermatitis, make sure that you have it all nicely covered to prevent exposure. But read through that list there on page 345 in chart 19-2. Other reasons that someone may be exposed to HIV includes unconsensual, unprotected sex and sexual assault, and consensual, unprotected sex. But, you know, the Monday morning regret, you can go and have HIV testing done at that time, and they will usually put you on prophylaxis if that is a concern. Treatment. Again, just take a look at the treatment they use for post-exposure prophylaxis. You will not be responsible for that, but just take a look so that you're aware for your own knowledge base, that if you do receive a needle stick from a source that cannot be identified in the hospital, this is basically what they will do for you. And this is the same 28-day regimen that they use at the hospital that I work at, and other ones throughout this area. So just take a look at it for your own knowledge base. You will not be responsible for that for the test, but I think it's important that we as healthcare workers are aware of what they will do if we have a stick. I'm going to stop here, and I'll come back with HIV classifications in our next video.